Good morning, madam. My name is Osvaldo Rodriguez. I'm the nurse who gonna assist you. Can you tell me, please, your name?
My name is Maria Perez.
Please. What is the reason of your visit today?
Annual physical.
Okay, thank you. Please come. Please, Maria. Previously, to go to the room, let us measure your weight and your height. After cleaning our hands and wear gloves, we have to check all items we're gonna need to do the physical examination of. Muy bien. Pienso que as a part of the vital sign, we have to also assess the pain level of patient. Madam, do you feel any pain?
No.
We have to ask the patient if she has any chronic disease, any family history of any chronic disease, any surgery history or something like that.
No.
For your mom or your brother or your father's side? No?
No.
Are you taking any medication right now?
No.
No? You have any history of allergy or any medicine, any food allergy or something like that?
No.
No? Blood transfusion previously? Did you receive any blood transfusion?
No.
No? Any surgery history previously?
No.
No? Okay. Trauma? Accident?
No.
No? Okay. Do you know where you are, madam?
Yes, I am in a clinic.
Yeah. And do you know where are you living?
Yes, I living in Austin.
The first step of head to toe assessment is the head and face examination. I'm gonna proceed now. Give me a little pelo. I have to check the air to see if there is any sign of symptom of infections, any alopecia. Check the ear of the patient, okay, to see if there is any redness or any secretomastoid process. There is a pain there, madam?
No.
Okay. Now I'm going to do the face examinations to see if there is any asymmetry, any scarf, any lesion in the skin, or any problem in the eyes, noise, mouth, and everything. There is no deviation of the septum of the noise. There is no asymmetry in the eyes. There is no asymmetries in the lips. There is no sign or symptom of any Bell palsy. Please follow the movement of the pens with your eyes and kindly don't move your head, okay? Then after the external structure of the eyes and to check the pupils, we're gonna do the Snell examination of patient. Please close one eye. And now?
F.
Now?
P.
Now I will check the noise of the patient. Symmetry to see if there is any deviation or any abnormalities in the noise. And no deviation. Please, madam, close one noise and breathe. After external examination of the noise, I will check if there is any tumor, any polyps, or any mass inside the noise. Okay. Now I'm gonna do the mouth examination to see how is the gums, how is the tongue, the teeth, and everything. Move your tongue to the right, move to the left, move your tongue out, open your mouth, please. No tumor in the tonsils. Then I'm gonna do the physical examination to see if there is any lymph nodes or any abnormalities in the vascular system of the patient. Also the position of the trachea and the thyroid examination. Okay. We have to check beside the muscle to see if there is any adenopathy or lymph nodes. Okay, it's bilateral. We're gonna check if there is any abnormalities in the arteries and the veins in this area, if there is any bruise or something like that. Okay, by auscultation. After, we're gonna proceed to do the thyroid examination. Please, madam, turn your head to the right, like this. Now to the left. Now bilaterally. There is no tracheal deviation, okay? And then auscultation of the thyroid gland. Next examination, I will proceed to do the examination of the jugular veins to see if there is any distension or abnormalities there. After next examination, we're going to proceed to chest examination to see heart and lungs examination, okay? First, we're going to do the inspection, then palpation, percussion, and auscultation. We're going to do the auscultation of the lungs bilaterally and compare each side, okay? Inspection of the chest should be in front of and also in the back of the patient. Expansion examination, okay? Breathe, madam. Auscultation of lungs can be comparing both sides. Comparing both sides, starting from the up and finishing the base of the lung. Now we're going to do the same examination in front. To proceed now with heart examination, inspection, palpation, and auscultation. We're going to start with inspection if there is any abnormalities in the heart projection in the chest, and then later we're going to do the palpation. It's important to do the palpation of the apex pulse to see if it's regular or if there is any abnormalities on this area. Then I'm going to do the comparison of apical pulse and radial pulse. Now is the time of the abdominal examination. Abdominal examination will be first inspections, then auscultation, and the last one will be palpation and percussion. We're going to start with inspection the abdomen. If the abdomen is, the shape of the abdomen is splayed, if it's bonded or have any abnormality, if there is any scarf or any abnormalities in the abdomen. If there is any depression of the abdomen, we have to check those things. After inspection, if the abdomen follow up the breath movement, we can proceed to the auscultation. We're going to start the auscultation in the lower right quadrant. Very important at this point to do the physical auscultation of the artery, renal arteries, aorta artery, renal arteries, and iliacus arteries to discharge if there is any aneurysm. Then after finish, we're going to proceed to do the abdomen and percussion. Percussion first and palpation last. Different in the projection of the liver and in the projection of the spleen. Can be dull in this area. If there is any dullness or any abnormalities in the abdominal percussion zones, we have to proceed with physical examination, palpation specifically, to discharge if there is any tumor or any mass there. Then palpation first will be starting for the low right quadrant, will be first superficial one, and then we go to the upper right quadrant, then left upper quadrant, and then low left quadrant. And after superficial palpation, we're going to proceed to the deep one to discharge if there is any pain, any tumor, or any abnormalities. Okay? With the same projection, with the same direction. After abdominal examination, we're going to proceed to do musculoskeletal system examination, inspection, palpation, range of motion, and stretchness of the musculoskeletal system. We're going to ask the patient to go down to see how is the guide of the patient. Please turn and go back, please. Then we're going to ask the patient to have a seat to see how is the position of patient while sitting. If there is any deformities, any abnormalities, to do the evaluation. We're going to do the inspection of the back and spine of the patient to see if there is any deviation or abnormalities there. Inspection of the back, touching if there is any, we're going to touch to see if there is any abnormalities in the spinal process, if there is any deviation, scoliosis, or something like that. If there is any abnormalities in the pelvic bones, okay. There is no abnormalities. And then, as a part of this part, we have to check if there is any tenderness in the joints, any deformities or swelling there, or pain as well. Okay. We have to check. Okay. No abnormalities. No bone deformities or abnormalities. Okay. The same in the legs. We check the bones if there is any tumor or any abnormalities. We check if there is any swelling over there. We check if there is any abnormalities in the joint, if the patient is able to do all range of motion. Okay. I will check the movement, the active movement of patient. We ask the patient to go against my hands, please, against my hands, to compare both. And now in the opposite movement, it's okay. Now here, it's okay. Now there. Okay, the same in the arms. Push me. Yeah, push to you. It's okay. Now it's time for neurological checkup. I'm gonna assess the orientation of patient, memory, and cognitive functions. Please, madam, can you tell me your date of birth?
September 5, 1989.
Thank you. Where are you coming from?
I'm from Venezuela.
And where are you living right now?
I'm living in Austin.
Perfect. Now I'm gonna assess the memory evaluation, short-term and long-term memories evaluation. I'm gonna tell the patient 3 words and I will ask again after 5 minutes. Please remember 3 words: morning, afternoon, and evening. I will ask you after 5 minutes. Please, can you walk over the line? Turn around, please, and coming back. Perfect. Please close your eyes and let me know if you feel something. Close your eyes, please.
Okay.
Do you feel something?
Yes.
And here?
Yes.
As a part of neurological examination, deep tendon reflex should be explored as well. Now I will proceed to coordination reflex. Fingers to noise test. Please, madam, put your hands beside to you and close your eyes. Left fingers to the noise. Explore the rumbar test. I will ask the patient to close their eyes and to put their arm beside and both legs together. And close your eyes for 20 seconds. It's time of skin examination, inspection, palpation, and turgor exploration. Inspection, we want to check if there is any change of color, if there is any discoloration, if there is any skin tear, any tumor, any mass, or any abnormal issues in the skin. We check the whole skin in the body symmetrically to see if there is any abnormalities, any scar, any petechias, pustula, vesicula, or something like that. Okay. There is no abnormalities. We check if there is any jaundices or something similar. Okay. After, we're gonna check the temperature with the dorsal of our hands. Okay. If there is any change of the temperature. Okay. We're gonna check also temperature there. We're gonna check also the distribution of ears in the low extremity to see if there is any abnormalities in the vascular system. Okay. In this moment, we can check also the pulse of the patient to see if they are present or not, to discharge any vascular disease, okay, if there is swelling or any other abnormalities. And then we want to check the turgor of patient, okay, to see if there is any dehydration or any problem of electrolytic balance, okay. The turgor of patient is normal. To finish with our head-to-toe assessment, we're going to provide the patient the information the patient deserves to receive and the education, just in case the patient needs any education for any diagnosis we have. Okay.